Very good evening, everyone. Namaste. So today we are going to discuss little bit about the master Tung acupuncture. So my dear friends, I am Dr. Hemant Sharma, and today I will speak about something about the master Tung. So after doing conversation, let's give me chance to speak. Then you can put if something in your mind in the chat box. Okay, so let's start. So master Tung acupuncture system is a very secret acupuncture system because many of the person are practicing TCM. The meaning of TCM is traditional acupuncture or traditional Chinese medicine. So the TCM is the traditional Chinese medicine. And everyone is very well known with the TCM because this is the more than 2005 years old science. But when we talk about the master Tung is also very, very old acupuncture system. But it was hiddenly practiced by the master Tung family, by the ancestor of the master Tung. If we do the comparison between traditional Chinese medicine and master Tung, so this is the very, very faster, means results appear on the table. Patient is telling you that, doctor, I am suffering with the pain, and you will put the point. Sometimes you can see the results in the 6 seconds. Sometimes, definitely, it may also take the time. But if you want to create your rapport in the clinic, then master Tung will be one of the best system. I always ask to my friends that whether you want to be successful in the clinical practice. If they tell yes, 100%, I want to be a very expert clinician, then I always suggest everyone to learn this system because this is very effective, very faster. This system is very effective and very faster. Let's start. So Master Tung was the first person from their family who has revealed this science. Before that, family were practicing, creating the greater results, but no one was there to share. And this science came to this world just near about 1973 to 75. Before that, even no one was aware that something with the name of Master Tung acupuncture. So directly, I don't want to go more in the more theoretical perspective. Directly coming to the points, Master Tung has divided whole body in multiple zones. Master Tung division is very, very easy, very, very easy. There is no point like lung meridian, pericardium meridian. The Master Tung has been divide whole body in this way. He has given the 1 number to the fingers, 2 number to the palm, 3 number to the lower arm, 4 number to the upper arm, 5 number on the bottom of feet, 6 number on the dorsum of feet, upper part of the feet, 7 number to the lower leg, 8 number to the thigh region, 9 number to the ear, and 10 number to the head. This is a very simple classification given by the Master Tung. But he used any number 2 times. If Master Tung was to tell you something about the finger, he will tell 1 1. The meaning of 1 1 is fingers. Then he has given the name like 11.01, 11.02, 11.03. Just he has given the name in this way. So he has divided whole body in this pattern: 11, 22, 33, 44, 55, 66, 77, 88, 99, 10, 10. So if you see this classification anywhere, like 33.01, 33.02, 33.03, so this is the classification of Master Tung. So all the points in the fingers, they are 11. All the finger in the palm, they are 22. Lower arm, that is a 33. Upper arm, that is a 44. Foot, the lower part of the foot, the plantar surface of the foot. So in this way, he has done the classification. So let's proceed now. Because today is our topic on the knee pain. So how can we successfully treat the knee pain? With the help of Master Tung points. So let's see. Master Tung never used the name like lung meridian, pericardium meridian, heart meridian in that way. But we always do the comparison with the meridian, and we do the comparative study in the acupuncture. When we talk about the meridian, they are like a river. Like in the river, water is flowing in the same way in the meridian. What is flowing? That is chi or vital energy. So this is the difference between meridian and river. River is carrying the water, but meridian is carrying the chi or energy. Like we can see the electrical wire. In the electrical wire, electricity is flowing in the same way. When we talk about the meridian, in the meridian, what is flowing? Chi is flowing. In each and every meridian, there are multiple points. In some meridian, we are having just 9 points, and in some other meridian, we are having 67 points. So when we talk about the Master Tung told, forget the points. 1 point is here, 1 point is here, 1 point is here, 1 point here, 1 point is here, 1 point is here. Master Tung told, forget the point. Master Tung told, if you miss the point, if your location is not correct, even after that, you will get the result. What things you should remember? The most important thing, as per the Master Tung, do not forget the root of meridian. Suppose I told you that this is the arm, and this is the one meridian. And I told you, kindly put 1 point here, put 1 point here, and put 1 point here. But why mistake? You are putting wrongly. You are putting 1 point here. You are putting 1 point here, and you are putting 1 point here. As per the Master Tung, even you are putting wrong points, you will achieve the results, because you are not missing the line. You are not missing the route. If you are on the same route of the energy flow, then you are right. Then you will achieve the result. So that's why Master Tung theory becomes very easy for everyone. Because sometimes we forget the distance, how many chun from here, how many chun from there. What we know, the root of the meridian, because there are only few meridian in the body. So this is the very famous statement given by Master Tung, that if you miss the points, no problem, but you do not miss the root of the energy. As per the Master Tung, each and everything of the body can be divided in 5 parts. Each and everything. Part 1, part 2, part 3 will be the center. Then part 4 and part 5. Anything of the body can be divided in 5 equal parts. Like, let's see here. So let's see the legs. Just see the lower leg. Do not see the full leg as well. Just see the lower leg. This lower leg starts from the knee. And I am just talking about the one longer bone, one tubular bone. Just take one bone from here. We know this bone is called tibia bone. So let's see in the other image. So I am selecting any bone at random. So let's see here. As per the master rule, you divide this bone in 5 equal parts. So this is the bone. The name of this bone is tibia. And I am dividing this in equal 5 parts. This is the part 1. This is the part 2. This is the part 3. Sorry. Part 3 in the center. This is the part 3. This is the part 4. And this is the last, part 5. So you have got the 5 parts. And remember these 5 parts as per the imagination. Now, we can see here the part number 3. Part number 3 is coming on the knee joint. So part number 3 is coming on the knee joint. So just remember part number 3. Now, let's proceed to the other bone. Now, let's proceed here. Now, if some patient is coming to you and telling, can you treat my shoulder joint? Okay, so this problem in the arm. So divide the arm in 5 parts. So let's see, this is the center. Part 1, part 2, part 3, part 4, and part 5. So one patient is telling you, can you treat my shoulder pain? This is the part number 1. Can you treat my elbow pain? This is the part number 3. So just we have seen in the legs, the part number 1 will treat the part number of this. So they will treat each other. So if someone is having pain in this part number 1, as per the master Tung, do not touch the sick area. Do not touch the sick area. If someone is telling you that I am having the pain in the shoulder joint or in the shoulder muscle, so do not touch this part. Just remember, divide the whole arm in the 5 parts, and this is the part number 1. So part number 1 will be treated by the part number 1 in the other part. So let's come back. So shoulder joint can be treated by here, from this part. Because this is the part number 1, this is the part number 2, this is the part number 3, this is the part number 4, and this is the part number 5, because we have divided the bones in the 5 parts. With the help of these 5 parts, we can treat that parts. So shoulder joint can be treated with the help of this part number 1. So this much easy concept has been given by the master Tung. So in this way, we can divide each and every bone of the body in 5 parts. Let's see. One patient is coming to you with the pain in the spine. Okay, spine. So we can divide whole spine in 5 parts. So this is starting of spine, ending of spine. Sorry. This is the ending of spine. So 1, 2, 3, 4. So suppose this is the spine. 1, 2, and this is the center. 3, then 4 and 5. So this is the lower spine. So lower spine can be treated by the 5 number. So this lower spine can be treated by the 5 number. Now I want to treat this with the help of my palm. So how can we go in the palm? How can we treat the lower back pain? So let's see. The very easy way to treat the lower back pain is going directly in the palm. So this is the palm. In the palm, we are having, this is the first bone, this is the first tubular bone, this is the second tubular bone, this is the third metacarpal tubular bone, this is the fourth one, fourth tubular bone, and this is the fifth tubular bone. So let's see, very common bone. Let's see the second one. And divide this bone in 5 equal parts. Just we are taking a single bone and dividing this in 5 equal parts. So this bone is starting from here, ending here. And we are dividing this bone in 5 equal parts. So this is the part number 1. This is the part number 2. The center is part number 3. This is the part number 4. And this is the part number 5. So if we insert the needle here on the part number 5, we can treat the lower back pain. And you know, this is the very famous point of the master Tung. The name of this point is Lingu. Lingu. The Lingu is the very famous point of the master Tung acupuncture because this is the one of the best point to treat the lower back pain. Now, one more freedom is coming. What is the freedom? As per the master Tung, suppose this is the bone. This is any bone of the body, or we tell it tubular bone. And you can divide this in 5 parts. 1, 2, 3, 4, and 5. Now see the freedom given by Master Tung. Master Tung told, even you can do the reverse. Same division. Now the same bone, but you can take, this is the 1, this is the 2, center is 3, this is the 4, and this is the 5. So this is called normal image, and this is called reverse image. You will not see this types of freedom anywhere else. What is the meaning of that? Let's see. What is the meaning of that? The normal image and the reverse image. The meaning of this is that I have taken one bone and I have given the number 1, 2, 3, 4, and 5. But even I can do the reverse. I can start the counting from the bottom. Either you start the counting from the top or you start the counting from the bottom. In both conditions, you are right. So there is no risk, there is no chance to do something wrong. So let's see here once again. As per the imagination number 1, we have divided this bone in the 5 equal parts. This is the part 1. This is the part 2. Center is the 3. This is the part 4. And this is the part 5. So lower back pain can be treated here somewhere. We'll see shortly. Now, I want to do not in that way. I want to do the reverse. Where I have given the number 5, I want to start my counting from that point. So in that counting, if we divide this bone again in the 5 parts, so this become 1, this become 2, the center is 3, this become 4, and this become 5. Wow, amazing. So we can treat the back pain here as well. So we can treat the back pain here as well. So these 2 points are the one of the best points for the treatment of the lower back pain given by Master Tung. As per the Master Tung, the name of this point is Lingu. And the name of this point is Dabai. 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 Lingu Dabai. And this is the very famous point. I know most of you are knowing this point. The Lingu and Dabai. This Lingu and Dabai point, one of the best points to treat the lower back pain. Just this point will not treat the lower back pain which is happening because of the dampness, because of the moisture air, because of the more humidity, and pain which is aggravated because of the humidity. This point will not work there. Otherwise, this is one of the best and amazing point given by Master Tung. Let's see the practical demo, because I know if you get someone who is suffering with the lower back pain, just you put these 2 needles and remember one thing. Always put in the opposite side. If someone is telling you, doctor, can you treat my lower back pain? Can you treat my... So just put this point opposite side. Now you will ask me, I told you for the knee pain, so why I'm telling you about the lower back pain? Because the knee pain is connected with lumbar 3 and lumbar 4 vertebra most of the time. The nerve from the lumbar 3 vertebra and lumbar 4 vertebra going and supplying the knee area. So many times you treat the lower back pain and person will get the good relief. in the knee as well. No, never both hands. Only one hand, opposite side. Let's see the practical demonstration. So we can see this is the union of first and second metacarpal bone. So first I am putting the dava, the upper one point, so stretching the skin and putting the point. The master tongue has been given number the 22.04, and this is called dava. And the next point will be lingu, where this bone is ending at the union of first and second metacarpal bone. So we can see here, this is lingu. Okay, I will show you other video for the clear detail. 1 minute. So this is the union of first and second metacarpal bone. So we can see the V-shaped structure here. And this is the point lingo. So how to put the point lingo? We are pulling the skin little and inserting the point. So let's see, this is the union point between first and second metacarpal bone. So pressing the point and pulling the skin like that. And after that, making the space and inserting the needle. After that, leaving the skin. Because as soon as we leave the skin, the needle will go very near to the bones. Very near to the bones. Sometimes this lingu point enough to treat the lower back pain. If from this lingu point, we go little anterior side on the second metacarpal bone. So from the lingu point, near about we are going 1.2 chun distal. From the lingu point, we are going near about 1.2 chun distal. This is the point dava. So one needle we will put here. So we will stretch the skin and put the point here. So this is the 2-point combination. This 2-point combination is one of the best combination to treat the lower back pain because of multiple reasons, especially if there is an involvement of lumbar 4 vertebra. If there is an involvement of lumbar 4 vertebra, then these are the best point. So you can try this point for patients. Either they are suffering with the knee pain, or they are suffering with the heel pain, or they are suffering with the lower back pain. You can insert them. This is the one of the best treatment for sciatica pain. Just make sure this pain is not due to dampness, not due to humidity. Because if this pain is because of the humidity or dampness, then our protocol, this point will not be applicable. See, if needle is not there, so there is one more technique. I will show you. If you don't want to put the needle, even you can cure the patient. Just 1 minute. So let's see. Even I am telling to many of my friends that if they don't want to stimulate the point with the needle, then they can do in the Marma style, Marma therapy style. So let's see, how can we place this point in the Marma style? So look at the point. I am just showing how can we place the point. So we can keep our finger over the point, whichever point we want to stimulate. Then with the help of finger pats, not with the fingertips, but with the help of finger pats, we can stimulate the point in this way. Right now, you can see my ring finger on the lingu point, but we have to target our points. This is just a style that how can we place the points. If you place the point in this way, then also you will achieve the results. Got it? Great. So let's proceed now. As per the master Tung, the heart is made by muscles. As per the master Tung, the heart and knee both are having very deeper relationship. What is the deeper relationship? That relationship can be seen because heart is giving blood circulation. Heart is giving the proper blood circulation to the knee joint. As per the five elements, the knee or the joints are coming under the water element. And there is a very great relationship between the fire, means heart, and the water. So forget all the thing. Just remember one thing right now. If you want to treat the knee, just put the point. Those are good for heart. So now I'm repeating once again. If you put the point who is working for the heart, you will see the reduction in the knee pain within less than 1 minute, but your diagnosis should be perfect. All the point who is treating the heart, they are treating the knee as per Master Tung. What is the meaning of this? Now, remember one thing. If someone is having knee pain, so do not get stressed and think about, oh, maybe I have got heart problem. Don't think in that way. Because in one of my workshop, I told this concept that if you want to treat the knee, then forget the knee, just treat the heart. Then you will achieve the results. Then one of my participants was keep on thinking for 15 days. And because of, he was thinking all the time, oh, maybe my heart is not good. And he become hypertensive just by thinking. Then I told him, so I am telling, if you want to treat the knee, just treat the heart. But it means is not that if someone is having knee pain, means some problem in the heart, some problem in the valve, not like that. Now, if we see the heart is a muscular structure. So, if we want to treat the muscular structure, we have to put the needle, or we have to press the points. Either we want to put the needle or we want to press the points. Somewhere in the body where we are having more muscles. Because as per the master Tung, muscle will treat the muscle, bone will treat the bone, ligament will treat the ligaments. So if you want to treat the heart, which is made by muscles, that's why it is continually pumping 24 hours. So you have to search the point where you are having very good muscles. So let's see, there are a very great point in our body. It is very good for the heart, as well as it is very good for the knee pain. It will arrest the knee pain immediately. Let's see this point. So look at this. My target to treat the knee pain. In the master tongue acupuncture, we always put point opposite side. If I want to treat the right knee pain, I will put point on the left side in that way. So suppose this person is suffering with the knee pain. Which side? In the left side. So I will go in the right hand. And you know, in the right hand, if you see, this is the deltoid muscle. Where we are giving the injection. And this deltoid muscle is a very big muscle. This is elevated muscle. And if you see the body from the front, this muscle coming on the level of heart. So when we put the needle in the deltoid muscle, or when we press this point in the deltoid muscle, this is one of the best points for heart as well as knee. So this is the deltoid muscle, and this is the top of the shoulder joint. From the top of the shoulder joint, if we go near about, if we go 4 finger down, so 1 finger, so this is the finger number 1, finger number 2, finger number 3, and finger number 4. So under the 4th number finger, or in the acupuncture, we are telling it 2.5 chun. This is the point. This point As per the master Tung, the number of this point is 44.06, which is one of the best point for heart as well as knee. Just single point many times enough to cure the knee pain. Not only the knee pain, if someone is complaining you that I'm feeling chest pain, I'm feeling angina pain, I'm feeling very suffocation, I'm feeling palpitation, increased heartbeat, hypertension, this point, one of the best point, the 44.06. Because we are having very good muscle here, and muscle will treat the muscle, and heart is a muscle. Second point, this is on the heart level, on the same level of the heart. So let's see the exact location of this point in the other image. So look at this person. This is the, we can say, this is the bone. We can see the name of this bone is humerus bone. And this is the top of the shoulder joint. And here we are having very vigor muscle. The name of this muscle is deltoid. And this muscle is on the level of heart. So from the top level, if we go down, and we are coming 4 finger down or 2.5 ton down. So this is the point. This is the point which is excellent point for the heart as well as the knee pain. And this is very easy to search because we have to feel the bone, and this is just in the front side of the bone under the 4th number finger. It is so effective points. I have treated many patients just by this point. You can do the pressure or you can put the needle on this point. So this is the point. Is very effective for the knee pain, or even you can do the tapping on this point. If someone is suffering with the knee pain, you tell the homework, you give the homework, then kindly do the tapping on these points. Kindly do the tapping on these points, morning and evening, at least 100 times. If someone is doing tapping, then you can suggest the tapping on the both side, right and left both. So by doing the tapping, he is stimulating the function of the heart as well as knee pain. So this is one of the best points. Now, one patient is coming to you and telling, doctor, I feel lots of difficulty when I am climbing the stairs. And when another patient is telling you, doctor, I feel lots of difficulty when I am getting down from the stairs. So if one person is telling you, doctor, I am feeling very difficulty if I am climbing the stair, so this is the problem connected with the bones. And just by 3 points. 1 point will be the same, which we discussed, the 44.06. And 1 point will be here in the palm. We can see here. So look at my hands. So you will recognize the point. Even many person putting the chana, chana seeds. So look at it. If you see my palm, and I am drawing a line like that. I can feel the crease here. So this is the I can feel. I am drawing a line here. This is the muscle, and this is the just border of muscle. The name of this muscle is thinner muscle. And we are feeling the border. Where is the thinner muscle border is ending? So we find the border. Now, we have to locate only 2 points with the help of thumb. Point number 1 will be here. And point number 2 will be here. So this thumb is called Wanchun. This distance is called Wanchun. So first point I will search on the Wanchun distance. And second point I will get on the Wanchun distance. You can put the chana seeds, or you can put the needle here on the both points. So put these 2 points with the 44.06 on the opposite side, and you will see the results immediately as soon as you put the points. If you put the needle, then you will see the results immediately. But if you put the seeds, then you will see the results maybe in the 30 minutes to 2 hours. So if someone is telling you that I am having difficulty in the climbing the stairs, when I climb the stair, when I'm going in my 3rd floor home and I feel knee pain. So this problem is connected with the bones, and with the help of these 3 points only, we can treat very nicely, immediately. Excellent points. The 1 point will be on the shoulder joint. 1 point will be here, 44.06. And 2 point will be here. We can even do the acupressure here. So in that way, all the 3 points are on the opposite side. In the master tool, just remember the formula of opposite side. And kindly, when you achieve the results, share in the group. Because I have seen the results in 100 patients. I have conducted many camps. In the camps, I am putting needle foot and going fast. Even after that, we see the results. And we don't have to stimulate the point. We don't have to manipulate the point. Just put the point. That's it. Enough. In the master tone, we are not doing tonification. We are not doing sedation. Just we are doing stimulation. Either with the seeds or with the acupressure or with the needles. Now, one patient is telling you, doctor, when I climb the stairs, I don't have any problem. But when I getting down, I'm having knee pain. What is your diagnosis? Can you tell me? What will be diagnosis? When he is going up a stair, he's okay, no knee pain. But when he's going down, coming down, from the stairs, he is having knee pain. What do you think? What is the difference between both the things? Right, that's the ligament problem. Perfect. So if some patient is coming down and having knee pain, that is the problem of the ligaments of the knee. So if one patient is telling you, doctor, when I am getting down and I am having knee pain, then we will treat in a different way. Yes, muscles also. The more problem because in the knee joint, between the knee joint, we are having ligaments to hold the bones with each other. When ligament become weaker, then person is suffering with the pain, and especially when he is coming down from the stairs. So let's see what will be the protocol for this. So look at this. Pain while getting down from the stairs, it's a ligament problem. And when someone is suffering with a ligament problem, suppose one patient is telling you that I am having right knee pain, and it is more when I getting down from the stairs. Then what we'll do? So we will choose the different point set. In this set also, what we'll do, we will take the liver 2 and liver 3 on the same side. On the same side. Liver 2 and liver 3. Liver 2 and liver 3 will be on the same side. And on the opposite side, we will put pericardium 6, pericardium 4 plus 44.06. These 3 points. Just with the help of 5 points, you will see the results very immediately. So I have shown the location of liver 2 and liver 3 in this image. This is the location of liver 2. We can see this is the first metacarpal bone. This is the second metacarpal bone. In between, we are having liver 2. And where these two metacarpal bones are uniting with each other at the junction, we are having liver 3. Let's see in the other image for clear understanding. So we have to put the liver 2 and liver 3 on the same leg, on the same side where knee is paining. So look at this image. Where our first and second, this is the first metatarsal bone, this is the second metatarsal bone. In the starting, we are having the location of liver 2, and where this metatarsal bone unite with each other ending, that is the location of liver 3. So we are putting the liver 2 and liver 3 on the same leg. If someone is suffering with a right knee pain, we will put this liver 2 and liver 3 in the right leg or same leg. And we will put pericardium 6 and pericardium 5 in the opposite leg. So let's see. the location of pericardium 6 and 5. So look at this image. From the wrist, if we got two fingers, from the wrist, if we go three fingers, that is the location of, in the center, pericardium 6. And from the wrist, if we go four fingers, that is the location of pericardium 5. Or in the acupuncture, we are telling 2 chun and 3 chun. So just we have to measure from the wrist joint, and these 2 points are in the center. So we have to put the pericardium 6 and pericardium 5 and 44.06 opposite side. As soon as we put the point, you can ask the patient just after 1 minute, he will tell you, doctor, there is a good change. Just remember one thing. When you are treating the patient suffering with knee pain, tell the patient, move the knee little bit during the treatment. Just move the little bit. Because as per the master Tung, we are sending a great energy on the knee joint area, and the patient has to disperse the energy. Otherwise, he will feel little heaviness, and the results will appear after 30 minutes or 1 hour, because we want the results on the table. So in that way, we have seen here, as per this location, if you're putting the liver 2 and liver 3 point on the same side, and pericardium 6 and pericardium 5 points on the opposite side, plus 44.06, then we can achieve the results. One day I organized one free camp. Then I told, okay, all the patients suffering with the knee pain, sit separately. Kindly sit separately. Then just I added either liver 2, liver 3, pericardium 6, pericardium 5, or this protocol, 44.06 plus 22.01 and 2. Near about, I inserted just these two protocols for more than 55 patients. And I asked from the 45 patients, they told they're feeling much better. So I think these points is one of the best point. This point combination is a very good point combination, and you can give the relief to many patients. The knee is not a small area. Knee can be treated with multiple points protocols. So now, there is a many pattern. If someone is lying down on the bed in the night and suffering with the knee pain, so it is separate protocol. First, these two protocols working on most of the problems. But suppose someone is telling, when it is night and I am lying down, I am suffering with the knee pain. Then we have to increase the heat in the body. So for that, there are many different protocols. Before proceeding to that protocol, I would like to tell you one thing. Before proceeding, that we are conducting a very detailed mastering workshop from the 19th September. And the duration of these workshops will be 6 months. So the 19th September, we are starting a very new workshops and duration will be 6 months. And we will take class only every Saturday. Only Saturday. In the evening. But as soon as you enroll, we will provide you 40 plus hours recorded video of the class, because right now we are talking to each other. In the same way, we have already done the classes earlier and we have 40 plus hour recorded video, recorded class. I have uploaded the complete class on my website. As soon as you enroll, we provide you all the video immediately. And after that, we will sit together every Saturday in the evening time. So just after completion of this workshop, I will put the link in the group. And you can see all the recorded video. Even you can install my app. If you install the app, so in my app, you will see the online Master Tung Acupuncture. So I will send you the link of this course, online Master Tung Acupuncture. And earlier we have declared the 12th September, but right now we have changed the date and we are starting from 19. 19 is a Saturday. So you can enroll for this. If it will be very wonderful for you. And I'm sure it will change your practice. Because it has changed to practice. If it has changed already, many clinicians, and they are doing very good treatment nowadays. So we are starting this workshop from the 19th September. And if you want to learn the Master Tung Acupuncture in a very detail, you can see in this course. In this course, there are 50 hours of contents. There are recorded video more than 15 hours. And we will learn the complete subject in very detailed way. These are all the videos. And I have explained each and everything, whatever I have got from various sources. So you can learn. If you want to become a very good clinician, that this course will be very good for you. So all the videos are available on my website, which you can see there.